This is one of our health talks we give twice a month. I think this is number 8, I believe. This one is on Citizen Health and our latest initiatives for raising money. Basically, it's our seed round. And this health talk is going to be discussing what we are doing, where we're at, and what we're trying to do. So as you can see here, we are a company that's focused on rebuilding healthcare on an open and transparent marketplace. And before we can really get into what we're doing, we've got to explain why we're doing this. And I want to give just a kind of a personal story with myself, my background, and what triggered the start of Citizen Health a few years ago. It starts with my previous company, Pharmedia. We developed for pharmaceutical companies and pharmacy benefit managers. And over about 4 years, I saw a complete world of insurance manipulation that people just never see. I watched local mom and pop pharmacies scale from barely breaking even to raking in over $50 million a year. And these pharmacies, they were gaming the system. They were working with pharmacy benefit managers to bill insurance companies for just maximum reimbursement. Along the path to that, there was a lot of fraudulent activities that did happen. And when I saw this stuff start to take place, I realized that health insurance as a product it's not doing a good job. If it's this easily gamed and it's this bad in terms of helping the patient out, then this is a widespread problem, because we saw just $1.5 billion worth of fraud. And I mean, it's estimated there's a whole lot more than that happens across the country. So when I was dealing with these companies, I could clearly see that there was a problem. There was a problem with insurance. And about the same time that I realized there was some potential fraud going on, the FBI also realized there was fraud going on, and they conducted nationwide raids of a lot of these pharmacies. And about that time, I was getting ready to pivot Pharmedia to Citizen Health to start fixing the problem versus enabling the problem. And around the same time was the birth of my firstborn son. And when I brought him home from the hospital, this was about 2 or 3 months after these pharmacy raids. And I was just imagining what his life was going to be like when he was my age. You know, what's the world going to look like in 10 years out, 20 years out, and 30 years out? I thought about his school, sports. Then I started thinking about healthcare. How is healthcare going to look 30 years from now? And knowing what I knew from all the research that I did and then the previous company I was part of, I realized that if we continue down this path, healthcare is going to be absolutely disastrous for our kids. So we are effectively stealing from that generation. So I kind of just took it upon myself and made a pact with my son to use my talents and my resources to try to rebuild healthcare and try to fix it for his generation. So when I did that, I kind of made it a personal mission. I went out there and I found people with the same passion for fixing healthcare, and that's pretty much everybody on this health talk right now. We have a solid team of people that are dedicated to rebuilding healthcare for that next generation. So that's everything that we're doing. You need to look at it through the lens of we are rebuilding this for the long term, not just a quick product to roll out there and sell, but to fundamentally change what is wrong with healthcare. So that's our why. And the problems we are solving, this chart here, this graph, it says a lot for what we have going on in America. As you can clearly see, that red line is us, and it's terrible. We're actually ranked last amongst all our developed peer nations in terms of life expectancy, and we pay twice as much as other people, and we just get poor outcomes. So I'm ashamed to say that that's me here in America, and everybody else is so much better. So there's a lot that plays a part into this, and I think our last health talk was on incentive systems and how we got off track around 1980, 1985. We started implementing fee-for-service, and it just it got off track. But that is a major problem that we're attempting to fix. And one of the second problems is this. Who hasn't felt like this? I think anybody that has received a medical bill or has been to a hospital has received something like this. You just don't know how much your bill is going to be until 45, 60, 90, 120 days later. You get stuck with multiple bills. And the same thing for the doctors. They don't know how much these people cost. It's confusing for all the parties involved, and there's just no transparency. So this is what we're looking at here is the status quo. We have people that need healthcare services. I've deemed them healthcare buyers, and that's anybody that has a need and they're going to purchase a solution. You have people that sell those solutions to the people. So basically the patients and the healthcare providers. And we have all of these insurance companies making large cuts, convoluting the whole process, just really causing havoc on both sides. And if you look at how much we actually pay, we as the American people, you look at the premiums that we pay, the out-of-pockets, the co-pays, all the deductibles, and the taxes we pay for Medicaid and Medicare, we the people pay $2.6 trillion as a collective. That's a lot of money. It's really hard to understand that. But what we're trying to do is remove these intermediaries, these value extracting intermediaries from this equation, and instead connect healthcare buyers directly to the healthcare sellers. And it's going to be a whole lot cheaper. If you actually look at every single procedure done in America for everybody, man, woman, and child, from birth to death, if you paid just with cash, you just whipped out a credit card or just wrote a check or paid with cash, it would be about $900 billion, rounded up to $1 trillion if you want to do that. And that's a whole lot less than the $2.6 trillion that we pay. And once you see that, you realize that, okay, are the insurance companies actually providing value? And that was kind of my thesis was, do they provide value and are they even needed? And once you start seeing these numbers, you realize that, no, they're not needed. They're not providing a good value. So there could be something else. And that is what we're building. We're building this ecosystem that connects the healthcare buyers to the healthcare sellers in a transparent and open marketplace. So starting off with Citizen Health, we're focusing on not just one product. We're more of a technology company developing solutions, multiple solutions that work together as a whole to fix healthcare. And the first one we have developed is called Humantiv, and it's a health operating system. It's going to start off as an app, but it's designed to optimize the health and wellness of a population by incentivizing people to pursue a healthy lifestyle using wearable technology and sensors, smart sensors such as blood pressure cuff. We are releasing our internal beta. We're already actually testing this right now, but our public beta should be scheduled here in the next few weeks. And it's going to start off very simple. You can connect your Fitbit or your Apple Watch, import your data, generate a health score, start being active, get more steps throughout the day, and you can earn cryptocurrency. And I'll get into what our cryptocurrency structure is looking like. So this is designed to motivate people to go just be more active. So the idea here is to focus on proactive health, and we have a lot of plans for this, but starting off fairly simple. With Medoplex, now this is going to be the economic engine in everything we're doing. This is an open and transparent marketplace where those healthcare buyers and sellers can come and transact directly without insurance. So we've been calling this the marketplace for free market healthcare. It just completely eliminates health insurance. It's just a direct payment situation, almost like Amazon. You go there and you search for a surgery or procedure, and you just find that particular product and you purchase it directly from the seller. And tying these all in together, we have something we're calling a peer-to-peer health assurance. And it's a decentralized health sharing network, similar to a healthcare sharing ministry like Liberty Health Share or MediShare. It's a mutual aid society. Those have been around for hundreds and hundreds, if not a couple thousands of years. And it's where you contribute to somebody else's medical need. In return, they contribute to yours. So pretty simple, but we are using a lot of newer technology to streamline a lot of this and remove a lot of the friction. And I'll get into that next. So the crypto asset components of what we're doing. Now, I'm gonna hit on this for a little bit because some people think when they hear cryptocurrency, they immediately think Bitcoin, immediately think the dark web, buying drugs, whatever that was 5 or 6 years ago. Rightfully so. There was some bad stuff that went on with Bitcoin, but at the same time, there's bad stuff that goes on with the dollar every single day. But what this technology does, it does a lot. I like to think of not necessarily what it is, but what it does enable. And it enables the opportunity to take a a form or to create a new form of money, of value, and program terms and conditions into this value to go out there and do certain things based on what you programmed it to do. So instead of the dumb money, like you hold up $100 bill, it doesn't do too much. It just lays there until you pick it up and give it to somebody. But having some sort of programmable money, you can now program it to do certain things that eliminate intermediaries, such as insurance companies. Now, there's a lot that needs to go into this, and this is still a fairly new field, about where the internet was in the mid-90s. So we still have a long ways to go with this, but it has so much promise on completely eliminating a lot of the problems that we have. So for what we're doing, we have created, we've created 4 crypto asset components, but these are our main 3. One is our rewards token called the Medit, and this is what will be generated from Humantiv. Basically, you go get 1,000 steps, you generate Medit, and that's going to be our it's the cryptocurrency you get, and you can go purchase things on Medoplex, or you can sell them on an exchange. This is user-generated supplies based on what you do, and it's used in health transactions. Our plan is to supplement initially the dollar used in healthcare transactions, but eventually replace the dollar used in healthcare transactions. And then moving on to the Medix. Now, this is a security token, and ERC20 specs is basically just a standard that Ethereum has adopted. This gives a user voting rights in Citizen Health. So if you do hold a Medix token, you can vote in the direction of Citizen Health and what we're doing. A lot of the discussions we have, it comes up for vote, and this is the opportunity to say, yes, no, I don't like that, or hey, how about do this? You can also propose ideas. This is a fixed supply, so it's a finite amount. This is something that does go up in value. You can kind of think about this as an Apple share or just a share of a company. This would be a share of Citizen Health. And this is what you would be purchasing in this investment round. And then we have something called a personal health asset. This is going to be a non-fungible token. Now, fungible and non-fungible, those top two are fungible, meaning they can be interchanged. If I have 5 Bitcoin, I can give you 5 Bitcoin. We can exchange those, it's still 5 Bitcoin. But with these non-fungible tokens, they represent a unique asset. It cannot be replicated because it's unique to specifically you or to somebody else. This is going to be sort of like a health investment account. It's a lifetime. Every person at birth is granted one. They just have to accept it. And this is also used in our Medit price stability later on. So there's a lot we can talk about this. It's just kind of high level overview. But Humantiv, the first thing we're building that will be released here shortly, this is what it looks like. So as I mentioned, step 1, you just download the app. It's going to be in the Apple Store and the Google Play Store, and you connect your health data. It's pretty simple. You just log in with your Fitbit username and password. You just connect your data. It's done really quick. Then you pick a personal health journey, such as you might want to really perform at the top of your game, perform like an Olympian, or you might just want to be able to take the stairs every day. You know, everybody has different levels of health journeys, of personal health journeys. So we want to help you get to whatever you're trying to reach. And then step 3, you just be active. Just go take a walk, take the stairs versus the elevator, whatever that looks like. Go to the gym more. The more activity you have, the more Medit you can earn. So we are incentivizing people financially to go do healthy things. And then eventually we have the opportunity to import all your health data, your EHR records. We can do that now, but we will not be showing that in this app for quite some time, probably about 6 months or so before we start testing some things out. But the idea is to take all of your data from your medical history, from your wearable data, from your Withings, wireless blood pressure cuff, your scales, all of this health data, and combine it into a holistic view of your life over time. Up until now, there's never been anything this comprehensive in terms of health data. So this is going to be interesting how this works. And you own your health record. You take it with you. The idea is eventually we'll start opening it up for the ability to sell your data, and you will be able to see where it goes and track it. You will have complete transparency in all this, and it's only going to be sold by your consent. So you will be in complete control of it. And Medoplex, now this is where it goes down. This is essentially an open and transparent marketplace where these two parties, the healthcare buyers and healthcare sellers, can go and just transact. I've kind of already hit on this a little bit, so I won't go too much into it, but I'll just go on to the next few slides and describe, talk about what actually happens on the Medoplex and how these services are bought and sold. And let me go to the next slide, explain a little bit better. Well, let me go back. So these health service tokens. Now, just think of any medical service that a doctor has to enter in a CPT code to bill insurance. Now, just take that service, and instead of billing an insurance company for what you just did, think about a doctor taking that service and tokenizing it, creating a voucher, somewhat, so to speak, and put it up for sale on Medoplex. So now if somebody needs that doctor's service, they can go and purchase it directly from Medoplex, and that doctor will get paid immediately. There is no need for the doctor to bill insurance and wait 2 months later to finally get 30% of what they billed for. That's a headache. That doesn't need to happen. So now there's this opportunity for doctors to put up their services and have the healthcare buyers buy them directly, and then the doctor gets paid automatically. It's amazing technology once we get this going. And it can represent plenty of different things. You can have these tokens be coordinated across multiple episodes of care, complex episodes of care. They can be bundled together. For example, if I'm a self-funded employer and I know that I'm going to need, say, 10 knee surgeries one year, I can go ahead and buy 10 knee surgeries from a particular surgeon or various surgeons spread across the country, and I can pay one price for that. And if I'm paying up front, maybe get a discount, whatever that looks like in terms of negotiation with the particular surgeon. And personalized services and dynamic services, it creates new opportunities to find value in regarding healthcare services. Because in the past, you need to go to a doctor, or you need a procedure performed, you're kind of just stuck with your network. You can only go to these doctors. They might not be the best doctors, but now we're opening it up for anybody that wants to be a part of this. It doesn't necessarily need to be stuck just in America either. It could be global. Any doctor that wants to help. It doesn't have to be a physical visit. It can be virtual visits. And let me go back to this. And this is where a lot of the magic happens, is in the smart contract automation and these health service tokens. Now, one of the big benefits of blockchain technology is a smart contract automation. And this is essentially like a traditional contract, a paper contract. You have a lot of clauses in there saying if this party does this, then we can do this, so forth and so forth. Well, now you can codify these contracts, these terms, and they can execute based on certain things happening. So for instance, if I purchase this health service token, which is essentially a smart contract, I go to this doctor's office, we both agree that this procedure is done, then that money is automatically released to that doctor based on us agreeing that it's done. All this is done magically with this newer technology. That's why a lot of people are so passionate about this technology, because it does eliminate a lot of the processes that really slow down or create a lot of the inefficiencies in healthcare. So let me move on. And these are some examples of what these health service tokens will look like. Just complete mock-ups here. These are not actual prices. Well, yeah, some of them are, but just don't print this off and take it to the place. This is just an example of any physician can go in there and say, well, I want to offer one urgent care visit for $70. I'm going to put it up there, and I'm going to put an expiration date on there. These are my terms and conditions. You can kind of just use your imagination on what it could be. Anything that a healthcare seller can produce can be listed on this. And just imagine you go to Amazon to search for something. It would be very similar. You just go and search for and put your criteria in terms of price, in terms of maybe gender, location, value, quality, reputation, and then it returns a list of the particular services you are looking for based on those criteria. And tying all that in together, we now have the ability to offer these subscriptions. We've been calling them health as a service, or subscriptions to a healthier you. But this is the replacement for health insurance. Starting with direct care subscriptions. I'm sure everybody's familiar with DPC, just typical subscription to a primary care doctor. Either we will offer doctors to come on board and do this with us, and essentially hire doctors, or just allow this platform for other independent primary care doctors to come on board just to find extra patients. However that would look like, it's open to them. And the peer-to-peer assurance model, now this is unique. This is really cool. This is like that health sharing ministry, but with that personal health asset that I mentioned earlier, each person funds that in terms of it's going to function as their health savings account. And if they go above the amount that they have in this personal health asset, everybody else agrees to take a small fraction of their account and pay for your medical bill. And likewise, you have a small percentage of your personal health asset that is dedicated to paying somebody else's medical bill. Now, we're not talking about you're going to go broke with somebody else getting in a wreck. We're just talking about like a small couple dollars from each person's account. But it's knowing that you're also going to be taken care of. And all this is contractually done. It's automated. You really don't have to go through a process to do it. And this more than likely will be released, and we'll start testing it out kind of middle through 2019 just to see how it goes. But this could potentially eliminate the need for health insurance. It just creates a much better alternative. And for our initial target market, we've already hit on these self-funded employers, and these are the employers that they pay for their own medical bills. So if their employee does go and get a knee surgery, it might be $35,000 in one location. It might go across the street and it'd be $18,000. Well, we're looking at self-funded employers and saying, well, hey, we can find you the best possible prices and the best value. So purchase through our marketplace. And also individuals and families. And there's a lot of people that don't have health insurance. A lot of people that have really high deductible plans, and they need to find a cheap cash price or something that is valuable to them. So that's going to be a target market. And also freelancers and contractors, a lot of those guys out there that just don't have health insurance and just need to purchase services from time to time. Small businesses as well. And healthcare sellers, imaging centers and labs, I think that's going to be some low-hanging fruit because it's pretty standard across the country. MRI is an MRI. The price fluctuates a lot. And so we are trying to find the better priced MRIs and put on Medoplex. And if you see the asterisk by there, we already have a pilot program scheduled, and I'll talk about that on the next slide. And also independent primary and specialty care docs that are not operating in hospital systems, the ones that don't like insurance, and also surgery centers. So the first pilot programs you see here is Green Imaging. They are a medical imaging service, or they have multiple facilities across Texas. And all in all, I think that's about 94 locations, and they are planning on scaling out throughout the Southeast. And they have a sister company called Lucent MD. We talked with them a couple of days ago about being their technology provider to help them scale their plans across the country. And also New Care MD, that is direct primary care clinic here in Mississippi, where I'm at. And what we will be doing with Dr. Michael Walker there is a common problem with direct primary care doctors is the ability to refer their patients to a specialist with the same cash price that they're operating under. As of right now, it's almost impossible. I mean, you send one of your patients that doesn't have insurance to a hospital, they would like to know what that price would be beforehand so they can price it out like any customer, like you're going to buy some tires or something. So what we're doing with him is giving him the ability to create his own specialist network based on direct cash pricing. So now DPC docs can go out there and create their own organic networks based on what they deem valuable for their patients. So this is going to be interesting to see how it plays out, because now these networks are going to start growing. The people that are in these networks are going to start creating their own networks. And now you're going to have just a whole big network of people paying with cash and not accepting insurance. So it'd be interesting to see how that plays out. So this is scheduled for the end of 2018. We're already probably the next month or two. I'm going to be going to Texas and spending some time to really nail down exactly what we're going to do and what the workflow looks like for green imaging. And the revenue sources, the subscriptions, the health as a service and the DPC subscriptions, just typical model there. On transaction fees, just processing fees between in the Medoplex, anywhere from 1 to 10%. Talked to a few doctors. There's a couple other marketplaces out there that actually charge 25% in transaction fees. So I think 1 to 10% is fair. And also monthly memberships for these referral network memberships. I've been told anywhere between $100 to $300 is probably right per doctor for that. And also products and services. This is kind of wide open there. A lot of employers are going to need help coming onto this and setting up our wellness programs. Of course, with Humantiv, didn't even talk about that, but that's a good opportunity for a wellness program with employers just to track their employees' fitness plans and their wellness initiatives. And set up sites for both sides, for doctors and the purchasers of these things. And our target markets, kind of already talked about that: DPC, specialty care, medical diagnostics, and the self-insured employers. You can quickly just see some stats there of how many there are. And I will say with direct primary care, it's estimated it's probably about 4,000, 5,000 doctors are practicing this now. 5 to 10 new DPC doctors a day. I mean, there's no real way to measure that, but it's, it's growing every single day. And as you can see, there's over 467,000 primary care doctors. So we're not even putting a dent in this. This is 1% of the entire population of DPC docs. We have a long ways to go. This is fairly new. It's only been around probably about 8 years now, or 6 years that I've been following it. And it is growing. It's catching on. Their friends tell their friends, and they tell their friends. You're going to start seeing it grow exponentially. All right, so let me go to the next slide. So for competitors, we are competing with health insurance for sure. In terms of, if you think of what health insurance is, they are really just a service company. They take money from patients and they pay to doctors whenever there's a service needed, and they are terrible at that process. But we are competing with that idea of being able to pay for health care. So you got these forward-thinking insurance companies. They would have to completely disrupt their whole entire business model to offer what we're going to be offering. But I'm not saying they won't do that, but who knows? Healthcare sharing companies, already mentioned that. There's a handful of them, there's about 20 of them out there, maybe a little more. They're doing well. They're growing, but they're still a couple, like 2 or 3% of the whole entire population, very small and growing. And any new and unknown startups, there's a lot of new technology, or these blockchain technology companies that are popping up that have big ideas. And also Amazon with their latest initiative between the whole Amazon, JP Morgan, and Chase, and Berkshire Hathaway. When they announced that, I just kind of laughed, and I was thinking, you've got to be kidding me. This is pretty much exactly what we're building, what I imagine they're trying to do. So I see that Amazon's probably going to try to buy us. I'm going to go ahead and quote that. They'll try to squash us, or we're going to try to partner with them. And I'm going with the latter. I think we can partner, make it a public ordeal where we're saying, look, we don't want these corporations to own our healthcare. We actually want to be a part of it and have it open sourced and have everybody, give everybody a say-so in it and own part of it. And of course, there's always risk to invest in this. Government regulation on insurance and the SEC regulations on digital currencies. Now, I will say that the road is paved for us on a lot of these things, the government regulation. We have a lot of favorable terms right now. I think that's on the next slide. The SEC has ruled on, has mentioned a few different times. They haven't sent out an official ruling yet, but their memos are very favorable for digital currencies, and we're following the book and we're paying attention to every single thing the SEC says, and we are confident in abiding by their laws. But also brand new technology. People are scared of new technology. I mean, look at fax machines. Fax machines are still used. It's hard to get people to adopt new things. So that's going to be a risk, is trying to explain to doctors what blockchain technology is, So that's why I think we don't even need to talk about blockchain technology. It's just really just a new technology. It's just buzzwords, next evolution of databases. It allows us to do a lot of cool things, but people don't need to be scared of stuff like that. But it will take an education piece. And also supply and demand. This is a marketplace. So we have to have the supply, meaning the doctors and services, before the demand is there to find value in it. So just a traditional chicken and egg problem. And why now? I think we've already talked about that. Current administration is really paving the road for this. They're trying to blow up the Affordable Care Act and remove the individual mandate. And there's a lot of positive regulation, especially with direct primary care, HSAs, these association health plans. So a lot of positive things. And some reasons to invest. It's is that me? It's absolutely a huge market. I mean, just in premiums alone, 1.2 trillion in premiums. That's insane. That's just a lot of money. People are constantly seeking better ways of health insurance, better alternatives. Perfect timing with technology, and we have an excellent team too. So with that, this is our team. Some things about myself. I've been a founder of a couple of tech startups, and the last one was Medio. Learned a lot there. We got Megan with us here. She's been a co-founder of 2 digital health tech companies, and is a force out there on Twitter, and just an excellent digital strategist. And we got John here with us as well. John has been a hospital CEO a couple times, occupied various executive positions on the healthcare, either the insurance or the hospital side. John gets it. He understands where the problems have come from and how to fix the problems. We also have Nabil. He was with us earlier, but he has been developing health technology for the past 15 years. Been co-founder or co-author on multiple patents, health tech patents. Really sharp in everything he does. Also, we have James Cunningham. He is our blockchain guy, main blockchain developer, and he's been developing blockchain solutions for NHS for the past 4 years with public Ethereum blockchains. Really sharp guy. And one of our lead advisors, our key advisor, is Dean. He is now the CTO of Mount Sinai Health System. So he just took that new position about 2 weeks ago. So he's gonna be helping us on that side with connections. So solid team, and we also have a solid team of advisors and ambassadors, and this is our ambassador program. These guys, everybody's out there giving some blog posts and retweeting tweets and just getting the word out there and spreading the vision of what Citizen Health is doing. And our roadmap here. I'm sorry, y'all. Can y'all hear that echo? Is that me? Okay. It's really hard to hear me right now. All right, so on the roadmap, our Medics governance testnet, this is basically, you have a Medics token. You can vote on the direction of Citizen Health and some of the proposals that we have coming up. That was launched on the testnet in June. We'll be finalizing and having it up here probably next month. Medic token is live, and it's going to be in the App Store probably end of this month. Actually, it already is in beta. And launching Medoplex, our pilot end of this year, and to launch it to the public in probably 2019. Use of proceeds, half the money we raise is going to be for development. And you can see the breakdown of everything else. And that's what we're going to do. If we raise this money, we're going to hire on 6 full-time employees, kind of go on the list. There you go. I think I just muted the noise. So our FAQs, this is what a lot of people ask. What did you get for your investment? Actually, I'm not going to speak on this because the SEC has, I can't speak on that. This is actually going to be on our StartEngine campaign page. A lot of things we can't say because we're operating under a Regulation CF exemption for this type of raise, where we can raise from accredited and non-accredited investors from across the world. So there are certain things we can and can't say, and that's one thing I really can't get into. But when and where you can sell your tokens, there are multiple security token exchanges being brought online by the year's end. We've applied for a couple of them, already had a conversation. And it's kind of the same thing as if you're buying and selling a stock of Google or Apple. The token would represent a stake in Citizen Health, and you can just sell that for whatever price the market is going for, or you can kind of set your own price and say, whenever it hits that, I'll sell it. So are there restrictions on the token resale or transfer? This is a common question. So for instance, if you buy this token right now, I do have the SEC's website pulled up over here. So if the securities purchased in a crowdfunding transaction generally they can't be resold for a period of 1 year unless the securities are transferred to the issuer of the securities, so back to Citizen Health, to an accredited investor, so just transfer it to another accredited investor, or as a part of an offering registered with the commission, don't know what that means exactly, or to a member of the family of the purchaser or equivalent, or to a trust controlled by the purchaser, or a trust created for the benefit of a member of the family of the purchaser or equivalent. So you can transfer these. That's possible. So what happens if these Medix tokens don't get listed on an exchange? Well, that just means you can't turn around and flip it for quick profit. You still own equity in Citizen Health. So just like any investment. And why blockchain? Oh, that's a long conversation there. No, it's just this new technology that does, it eliminates a lot of the problems that are evident in healthcare right now. Just a lot of the friction points and just a lot of the processes that involve people. There's a lot of manual processes in healthcare that the more manual processes you have, the cost to do that is going to go up. So you remove those processes, you automate those processes with code, the price starts coming down, or the cost starts coming down. So there's a lot to blockchain, and I believe that it's going to be a driving force for a complete world of abundance later on in life. I think we're going to zoom out and look at the 100-year map, 200-year map over the course of history, and you're going to see a little blip around 2015 where we just started going up. We have a lot of exponential technologies happening, nanotechnology, AI. You're about to see explosion of new technology over the next decade. It's going to be a very fun time to be alive. So all this is tying in to creating a perfect world where we can fix healthcare. And that is all. If you do want to invest, go to startengine.com/Citizen Health, or you can just search Citizen Health in their search box. Go in there, and it's fairly easy. You just click invest, and I mean, in 5 minutes you can be done creating an account and everything. And that would be it. So now I'm going to open it up for questions. Right. All right. You might have any questions?
So we had one from, oh no, go ahead, Dr. Ravi.
So, I mean, I am enamored by this whole thing. Number one, I didn't know anything about blockchain until 6 months ago. And I mean, now I read up on blockchain at least 1 hour every day. And I mean, I want to figure out this process wherein we can deliver care in, say, in India. And I think blockchain is the only way in which we can do it. And just wanted to see, suppose a company, I've been talking to many blockchain companies. I'm trying to figure out what is the long-term sustainability of a company and how can one determine that, and how does that apply to Citizen Health?
The long-term sustainability of Citizen Health?
Yeah.
Well, the idea here is to create a company that functions like a co-op, if you will, like a collective, where everybody has a say-so. So the idea here is to take the patient and the healthcare provider, physicians, and the care team and design healthcare around them, and design a system that works for the people actually in healthcare. I'm not too concerned about the stakeholders, the big hospital system, those pharmaceutical companies. But let's design something for the people that really need it. And having something like that is built by the people, for the people, I think it has a long-term staying feature, just because this is something that we want. It's not something that's thrust upon us that we don't want. So, in essence, it's going to get better. It should get better with every single person that we bring on, creating these network effects, because then you start learning more and more about what this other person needs and what they want. I'm getting more feedback from wisdom of the crowds, so to speak. But with data, the more data we have, with Humantiv, all this data that we are aggregating, the more and more data we have, the more we can do with that. And later on down the road, the whole idea of kind of the much larger plan, the 30-year plan, is to take all this data, to have all these people working together to eventually try to cure diseases. Because I do think we'll be to that point in 30 years. We have enough technology, we have enough data, we have the resources now, because we're saving trillions of dollars, that we can focus on trying to solve diseases. So that's kind of the long-term plan for that. So sustainability, it's going to grow and grow and grow. I do think more doctors are fed up with insurance.
Yeah, but me being a doctor, I can look at it from both ends of it. And also, I happen to be an entrepreneur who has invested in a startup company, and it's 5 years or 4 years since we have done this. I think 4 years, and we are turning to make money in that startup company. But my problem is trying to figure out how long an entity like this can survive and make money to make things that impactful change that you want to see. Of course, Brennan, I don't have any doubts about your passion to do it. I mean, like, I'm sold on it. I mean, I already saw your YouTube videos. I already talked to you, and the question just comes down to, for me, trying to understand the passion behind it and how long is it going to survive? I mean, like, how long? I mean, you're in this for 10-year run.
This is my next 30 years. I mean, I've dedicated the next 30 years of my life, my professional career, to making this happen. Because like I said, when my son was born, I kind of thought about what his life was going to be like 30 years from that point in time. And that's that personal mission that I had, that vision I had for where healthcare could be then. I determined that I was going to make it happen, because I can look back over the past 10 years of what I've done, and I can estimate what's going to happen in the next 10 years. And then it's only another 10 years after that. And it's just another 10 years after that. We hit 30 years. If you look at it in the terms of decades, you can start making big plans. And that's one thing that I do. I don't like to make these little small plans, a little small app, and turn around and try to sell it for a few million. I want to make fundamental change, because we need fundamental change. There are people literally just dying out in the streets because we just are not using our money effectively. I've been tweeting about that a lot lately. We waste enough money in 2 weeks to really end homelessness. But we actually do that. But get down to it, there's a lot of wasted money in healthcare, and what I want to do and what Citizen Health wants to do is to fix that, and to repurpose that money for benefiting humanity, for feeding those hungry children, and for putting people up in a house, for providing care for somebody in the Appalachian Mountains that can't get access to, really take care of the people. Something that I think is just we're failing at in this country right now. And I say in this country, we talked about in India, and since we talked about it, I don't know if it's because I've been Googling stuff about India, but I keep getting a lot of news articles about the healthcare system over there. And there's not a country right now that says, hey, we have healthcare figured out. No, there are serious problems in every single country because they're still operating with this intermediary system, whether it is a government system in the middle, there's still a very large intermediary that's taking too much of the money out. So the long-term sustainability, I think, profitability-wise, it's kind of hard to estimate, but once we do launch Medoplex, that should be a revenue generator right there. And I like to just grow organically and not necessarily take on a lot of VC money where they're just saying, hey, you got to make these profits. Not so much. Focus more on, let's just build something that's valuable to the physicians and to the patients. And if it's valuable, let them pay us. That's kind of where I'm at with that.
Brennan, I think I'd like to add at least one thing on that. You talked about your son. We just had our first grandbaby back in October. And so these are the people that we're building Citizen Health for, but they are also the people that by investing for them or having them invest, they can be the sustainability. They protect their families and their children. There's where I see the sustainability. The profitability, again, I agree with. That's kind of hard to judge. And also to address, I'm very familiar with the Indian health system, at least the way it used to be a few years ago, that is pretty much a cash-based system. I know there have been some attempts at inroads for insurance, but what a great system to look at for the citizens of India and the providers. I hate that word, sorry, for the doctors. But the people that are involved in delivering healthcare in India, to be able to make those transactions behind the scenes, if you will, but not secretly like they occur today, but they happen automatically, I think is invaluable.
Yeah, agree. There's a huge change that is needed in the care delivery process, and out-of-the-box thinking is what is needed.
I'm just kind of going through some of these questions on this chat here. So I must have missed them. There's a lot of talk about open source, and I'll kind of hit on that. For this to hit to be the most effective, I think it has to be open source. I mean, you look at all the technology we're interacting with right now, 99% of it is all open source. You might not know it, but the majority of everything that's built is built on top of open source protocols and open source software. So having the ability to open source the protocols, get feedback from clinicians and developers and anybody that can contribute to the greater good for what we're doing, that's necessary. I mean, having these closed off walls, that's kind of where we're at now. You got these pharmaceutical companies that sit there and they just want to follow their research and all their data locked up in a silo when they could potentially have a key piece of information that this other pharmaceutical company might need to cure a disease, but they just don't talk to each other. I think opening all this data, of course, taking all the patient identifiers out of it, but open sourcing the data and our technology and the platforms that we're building, you just don't know where that's going to go. But in the history of open source movements, you can kind of make a pretty good guess of where it's going to go. But I think that's a must. That has to happen.
I think, unfortunately, what happens today with open sourcing and algorithms and what have you, the insurance companies, the PBMs, Amazon to a certain degree, Google, all these algorithms, especially on the health insurance side, are used against you in some instances because they basically predict, your illness and your mortality, et cetera, but insurance companies use it to predict premium increases, in my opinion. So I think there's value to open source, and that's one thing that I know that Citizen Health does not intend to do with that information. It's, again, for the benefit of all those folks that are part of Citizen Health and others.
Let's see. Anybody else have any feedback or question? Or I guess a big question is, what do you not like about this idea? I mean, there's got to be something you say, well, red flag. What would it be, that red flag for anybody?
For investment or for the providers?
Well, for both. Let's go from investment side first.
I mean, any investor that tries to invest in it will always think, what is in it for me? Mm-hmm. I mean, there are crazy people like me who really wants to do it because I crazily believe that this has to be done for the impactful change that I want to see in healthcare. That's a totally different thing. Now, but like I've seen and helped raise funds for my other startup company, and I've noticed that the real issue is people come to the table with their money. They ask, what can I get out of this, man, Brandon? So that, but it's hard, it's so hard to predict. I mean, it's so hard to predict. So that is one major thing. And from a provider standpoint, I have something that I talked to you earlier, which will remarkably change the whole process. And I will offline talk to you and your co-founder, and we can blow the cap off this. I mean, like, it's done. I will talk to you on that later. That will take 1 or 2 hours of your time if you really want to listen to that. But if you can address the investment part of time, I mean, like, I know that you cannot completely address it, except there, initially you have to have these crazy people invest in it, and the idea and the concept, and hopefully make it happen.
I will say on that, we do have a unique way where investors can get money back. That's the number one thing. If I give you money, how fast am I going to get my money back? That's kind of the number one question. With the investment, you're buying Medix token. These Medix tokens, through Medoplex, through the transactions, the actual transaction fee that we're taking, if you hold a Medix token, you have the opportunity to take a percentage of the transaction. So basically, you're receiving dividends from the transactions on the marketplace. So that's going to be just like a dividend check once the transactions start happening. And also with these security token exchanges, you can turn around and sell it. You can get into Citizen Health and you can exit Citizen Health fairly quickly. It's liquid. It's a liquid investment versus the old way of investing in a startup. I mean, the only way you're getting your money back is if the company sells or goes public or raises some rounds, and you can structure that way. But now with investing into companies that have securitized their or tokenized their securities, it's very liquid. So you can get in and out quickly. You don't have to tie your money up for 5 years, 10 years. So that's one huge benefit of having these security tokens. But the other one is, you do have an opportunity to participate in the revenue share from the marketplace.
Thank you.
All right. Well, bye, Grace. Sorry, I just saw that. I guess Grace is worked off. All right, Robbie. Well, you have to take a call here. It's about to be 4 o'clock, so I will go ahead and end this. I just want to thank everybody for spending an hour listening to me talk over here. I appreciate it. And if anybody has any questions, feel free just to follow up with any one of us. Follow up with me, and I'll answer your questions. All right. Well, thank you all.
Thank you. Appreciate it.